A 76-year-old woman has recently been admitted to a local nursing home following a stroke. She's less mobile after a stroke and requires assistance for all of her activities of daily living. Which is the most appropriate way of assessing her risk of developing a pressure sore? A. FRAC score. B. The Braxton scale. C. The Glasgow Coma scale. D. MUS score. E. Waterloo score. I'll give you about 30 seconds to consider your answer. The correct answer is E. Waterloo score. We'll now discuss why this is the correct answer in more details and pressure sores. Pressure sores. A pressure sore, or also known as a pressure ulcer, is defined as localised damage to the skin and/or underlying tissue as a result of pressure or pressure in combination with shear. They usually occur over a bony prominence, and you can see on the picture on the right common places where pressure sores tend to occur, but they may also be related to a medical device or other objects. Risk factors for pressure sores include reduced mobility, nutritional deficiency, older age, pain, diabetes, and peripheral vascular disease. There are two commonly used risk assessment tools for predicting pressure sore development. The first is the Braden Risk Assessment Scale, which evaluates factors like sensory perception, moisture, activity, mobility, nutrition, and shear. The Waterloo score considers weight, skin type, age, continence, and mobility, along with special risk factors such as tissue malnutrition. How to classify pressure sores. Once a pressure sore develops, it is categorized according to NICE using the NPUAP, EPUAP pressure ulcer classification system. This helps guide treatment decisions. The stages are as follows. Category 1 is non-blanchable erythema. This means that the skin appears red but does not turn white when pressed, indicating early tissue damage. Category 2 is a partial thickness skin loss. This may appear as a blister or shallow open wound affecting the epidermis and dermis. Category 3 is full thickness skin loss. Damage extends deeper into fat tissue but does not expose muscle, bone, or tendon. Category 4 is full thickness tissue loss, deep wounds exposing muscle, bone, or supporting structures like tendons. Some ulcers do not fit neatly into these categories. Unstageable ulcers have an unknown depth due to slough covering the wound. A suspected deep tissue injury appears as dark discoloration, suggesting deeper tissue damage, even though the surface skin may still be intact. This is a picture slide to demonstrate what we've just discussed. It shows the classification of pressure sores as recommended by NICE. It demonstrates categories 1, 2, 3, and 4. You can pause the webinar if you want to see this for longer. Management of pressure sores. For management of pressure sores, it's always important to consider or suspect abuse or neglect, as this is a contributory factor, especially in pressure ulcers in children and more vulnerable adults. A nutritional assessment needs to be conducted. You can also consider the need for pressure redistributing devices. Furthermore, if required, there may need to be an assessment for the need for surgical wound debridement. Consider the need for antibiotic treatment And NICE also recommends considering referral to the Tissue Viability Nurse Service. Complications of pressure sores include cellulitis, bone and joint infections, and sepsis.